I'm going to turn you over to somebody who I consider to be a powerhouse of sorts in the planetary health community, and I hope she doesn't mind me calling her that. I mean it with a great deal of admiration. So Courtney Howard is a woman, a doctor, and a health advocate who really, in most circles, needs very little introduction. She's the past president of, as I mentioned before, the Canadian Association of Physicians for the Environment. And she recently published an article on a framework for targeted change-making for a healthy recovery from COVID-19. So I'm looking forward to hearing from her, as I'm sure all of you are. Take it away, Courtney.
Thanks so much. Can you hear me?
I can hear you just fine.
Perfect. Wonderful. So I want to thank everybody for joining us. I'm coming to you from Chief Dry Geese territory here in Yellowknife, Sombiquet. It's a beautiful, cold, clear day. I was telling Pema that I have an extraordinary hair day right now. It's just the best hair day ever. So I'm sorry it couldn't be shared via video, but we'll all just have to imagine just how well I did at that today. So climate communications and change making, we're going to focus on equity. And what I'm hoping to do here is make clear how when we talk about climate change, really, to do a good job of it, we need to be integrating multiple different evidence bases in series. So of course we know that we need to get the basic science evidence base right. We need to make sure that we know what the health impacts of, for instance, heat are on different populations, et cetera. However, the mistake we've made as a community, and I say that as a longtime member of the community for a long time, has been that we've then been communicating that basic science using non-evidence-based techniques. And that's really hamstrung us. And so what we need to do at this point is make sure that we are using the best of the communications evidence base along with the science evidence base, and then using a data-driven strategy to deliver that message to the target audiences that we want. And that may mean doing new things, interacting with social media platforms to find targeted audiences, et cetera, because otherwise I think we risk isolating ourselves. And, you know, I'm on the Canadian Medical Association board and sit around a lot of tables at the WHO, et cetera. It's easy for us to sort of wag our finger at other people and say, why aren't they listening to us? Like, they should just listen to us and put the blame on others, rather than turning around to look at ourselves and saying, okay, are we actually delivering this message in a way that in 2021 can be reasonably expected to move our audience? And I've found that, and I think it has to do with sort of, you know, conventional medical related ego, we've been pretty slow to do that analysis, and we can't afford that. We know that in addition to the pandemic and the health emergency of climate change, we're also in the middle of an infodemic, and that is having real consequences for the way we govern ourselves and the way public health advice is processed. And so I'm really excited that we're talking about this today, and I just got a WhatsApp message from Renee Salas that she's really excited, Pema, that you had the infographic from her policy brief in your presentation. I thought she'd like to know. So this picture is a picture of the Mackenzie River Delta. And so this is a picture that I took about a decade ago now. I was a locum at the time, and I was flying from Inuvik over to Ecological. And this is one of the most rapidly warming places in the world. So this part of the world is about 3 degrees Celsius warmer than when an 80-year-old elder was born. And you can see that there's a lot of water there. And so there's a big difference when you're talking about the difference between solid water and liquid water. So freeze-up was happening at this time. And so you can imagine a later freeze-up, more unstable ice makes for a more difficult hunting, fishing, with food security impacts, the rapidly changing appearance of the landscape as lakes disappear, as the permafrost under them melts, or permafrost slopes subside into landslides, is upsetting for people. And so some of the first studies into solastalgia and ecological grief were done in Indigenous populations in northern Labrador, referencing feeling homesick when they're still at home given the rapid change. So this happened to be where I first learned about climate change and its impacts on health. The first commission on climate change and health had just come out in the Lancet saying that climate change is the biggest health threat of the 21st century. And I was pretty upset to realize that I just spent my 20s learning about emergency medicine, which I thought was going to cover the biggest health emergencies, and then there I was, I completely missed one. And so I've sort of spent a decade since then trying to make sure that we get our education, our policy, and our advocacy up to speed. And so moving on to the communications evidence behind why I just told you that story, it's because there's evidence that including your story in the story that you're telling means that audiences are more likely to trust you. And so I always include why I care about climate change and health and equity right up front, because that means that people are more likely to make a connection to me as a person. And Pema, I'll let Renee know you're a fan. And it means that they recognize our humanity and our motivations. If we don't give that story to people, they're much more likely to pencil in something, and it's not likely to be very correct. And another aspect of this is visuals. So I used to feel like a complete idiot, still do, getting photos taken for media, etc. But the reality is that we live in a very visual age. And so that photo there was taken by one of the North's best photographers, Pat Kane, for a story in Canadian Family Physician. And this was a few years ago now, and I was still feeling really awkward having this kind of thing happen. And I happened to have James Evidencebased up here, who's a hero of mine, former international president of Doctors Without Borders when they won the Nobel Peace Prize. And I just today pressed submit on the study that we worked on together into wildfires. And I said, James, I feel so silly. And he looked at me and he said, it's part of the job. And so us realizing that, in fact, a lot of the time when we do this work, our narrative becomes part of the narrative. And to realize that on a certain level, we may end up becoming characters, or the people that you are speaking with or profiling become characters in the work. And to try to, I find I have to put my ego to the side and just do what is best from an audience-centered standpoint in order to deliver the product that communicates things the best. And that means that I personally need to get over a certain residual degree of shyness. And, I think that will mean different things for different people. So essentially, at this moment in time, our job is to completely reframe the way we look at health. And this is a very different thing for you than, for instance, if I'm presenting this to a bunch of orthopedic surgeons in a hospital, because really, when I went to school, I thought that health happened in hospitals. That's why I went there. And what I've since realized, and this is a diagram that's in the supplement for this article, is that everything we do in the hospitals and healthcare system depends on the stability and our ecological determinants of health and our ecological underpinnings. So now when I'm presenting this to community audiences or medical audiences, decision makers, et cetera, I talk about a planetary health nest. So I will, even on Zoom, I will actually get my hands up and sort of link my fingers together as though I'm making a nest so people can see it, and say water, soil, things like sun and climate, those are our ecological determinants of health. And not only do they each have their own impact on our health, but we need them to be stable in order for them to form the foundation required for us to form political systems, social systems, et cetera. And then those, in turn, give rise to the layer of social and structural determinants of health, things like income and housing. And those, again, need to be very, very stable. We need a focused amount of resources, and we need to make sure that it's all very well organized. And only then do we get to have a healthcare system. And when you do a review in terms of the overall proportion of health status due to healthcare, Trevor Hancock and I did this a couple of years ago, and we estimated it's between 5 and 25% of overall healthcare status is due to healthcare, depending on where you are. We decided to go with 20% for the purposes of this article. In Canada, the Canadian Medical Association usually quotes 25%. I'm sure you have your own favorite number, but I do find that this is news to most people, certainly not you, but to most people. And so if this image is helpful to you, you can find it in that supplement. There is evidence that we process images, as you know, in a different part of our brain than text, so I have been trying to work a lot with simple images. Another one that may be of use to you, this one came from the 2019 Lancet Countdown Brief here in Canada, and it represent some climate health impacts just in a single snippet. I put this often on the cover of policy documents if I'm going to go brief a minister or something like that, to give them a sense all in one snapshot, because there's still some evidence in Canada that people haven't connected climate change to health. And so the faster we can do that in the limited time windows available to us to get people's attention, the better. And it's always, so you'll notice that this image is focused on Canada, and then just on the right there is a picture of an arriving family and talking about displacement and the potential for war and conflict. I spent 6 months working for Doctors Without Borders in the Horn of Africa, resuscitating malnourished children, and that for me was the moment where I realized that I had to rearrange my life in order to address this topic with everything I've got, because having multiple children die under my care was just the most upsetting thing that I've ever had happen to me clinically. And I realized that if climate change, if pediatric malnutrition is the biggest health threat of climate change this century, and I lived in a country with one of the highest per capita carbon footprints in the world, and probably the best thing I could do to help little people like this not be challenged by undernutrition was to stay home and work on our carbon footprint. And so I include this because, you know, there unfortunately, it can be difficult to ask Canadians to change their behavior based on a benefit for somebody on the other side of the world. And so ways of doing that, I use this story as a way of making it clear to people what it means to me. It may help. And of course, looking at the image here, this has been a very carefully chosen image, and it's been passed all the MSF people. You can see I'm not in the image. This is national staff helping someone from their community. The image was actually taken by a national staff member. You can't identify the child, so being very careful, again, with our use of images. And I find that talking about this, for the first long while, I didn't understand why people didn't act on the information I was giving them, because I've always been very thorough. I've done research in the past and am currently engaged in some, and so I tend to have very, very well referenced things. And so I would go to Canadian Medical Association General Counsel with a super well-referenced motion. I would tell them things, and then they wouldn't do anything. And I was like, well, guys, you were the ones who told me, because at the time I was a young member of the medical profession. So I was looking at them as my elders who had sort of told me to follow the evidence, and they weren't, and I couldn't figure out why. Well, it really made a lot more sense to me once I started looking at the diagnosis of climate change and its health impact as a diagnosis. So when I'm in the emergency department and I do a chest x-ray and I find something that looks like cancer, I then take a moment to make sure I'm centered. So I go to the bathroom if I have to go to the bathroom, I eat, I make sure that I'm emotionally centered so I can buffer any emotion that may come my way. I take a deep breath, I go into the room, I sit down, I prepare people, and I say, hey, I'm going to give you some bad news. I deliver the news, and then I'm ready for whatever reaction they give me. They may, and common reactions are, sometimes people are angry at you, they're externalizing their anger of the situation onto you as the messenger. Sometimes people have tons of questions. Sometimes they don't have questions and they want to leave. Sometimes people are tremendously cheerful. I've had people laugh. And I now realize that those are all totally human reactions to bad news. And we need to be really conscious of people's reaction to this news, to the news we're giving them, because we're essentially putting a challenge before them. And they may not have the energy in their bucket at that moment to cope with it or to action it. And that feeling of discomfort that people get when what they're doing isn't aligned with what they need to do is really, really uncomfortable. And we're all in that right now because our society isn't aligned with what the climate evidence is demanding of us. And so I would ask you to really, really, really consider, your emotional state as you head into these spaces. A famous medical book talks about taking your own pulse before being the first step at a cardiac arrest. I always did that as a learner. I still even do that sometimes. So I make sure that I'm grounded before I start running a cardiac arrest in the hospital, and I make sure I'm grounded before I move into these spaces. And just as I'm patient-centered in my clinical work, I make sure I'm audience-centered in my advocacy work, because it's at that point I find it's my responsibility to be grounded so that I can buffer the information that I'm delivering. And so at this particular moment in time with, COVID overlapping, people in isolation, just keep in mind, I visualize the energy in people's buckets as having withdrawals and things that input into it. So right now, uncertainty is taking energy out of people's buckets, financial worries, loss of their sense of place or role in the world, different types of inefficiencies, bereavement. And so what I try to do in my interactions is make sure that I'm imbuing them, putting energy into their bucket with helping them find a sense of purpose in the work, making them feel loved and valued in the work, having patience, bringing a sense of humor to the work. That's very, very deliberate. And in fact, there is evidence to show that when you teach with a sense of humor, people enjoy it more and they're more likely to remember. So keep that in mind. And just practical help. Sometimes people just a little barrier, like maybe they don't know how to sign into a webinar, or if it comes to a protest, I really suck at making posters. And so I need practical help with people to help me make posters. So we know that internet searches for ecological grief and anxiety are skyrocketing. This was part of the paper I published with some other people in ecological grief and anxiety. So just know that even if people aren't mentioning this to you, it's there. And what is the precedent for this? Well, the thing that most shows up in the evidence base is the threat of nuclear war, although I suppose we could now talk about the shared threat of COVID. But in terms of those studies, what they showed was that studies showed that denial and avoidance were some of the worst results. So this particularly comes into play with families. So kids are receiving information from external sources and also from their parents. And so if either the factual nature of that information is not aligned, or the emotional resonance of that information is not aligned, they don't know who to believe, and it's confusing and stressful for them. And so we need to, I've been really encouraging families to approach this as a family, and for parents, again, to be very conscious of their own emotional reaction, because it's going to impact how their children feel. So, always very important to realize it could be worse. We could have a raging UTI. And there's evidence to show that making a plan alleviates anxiety as well as getting things done. And so I try to be very solutions-oriented. And it turns out they don't really teach us how to do that in medical school. So I came up with this model as a way to help people talk about new tasks and new change-making targets. So I used to sort of want to solve everything at once, and then I realized you actually make progress by iterative problem solving. So I choose targets on either a micro, a meso, or a macro level. So micro is individual level change making. I'm going to eat less meat. Meso is departmental or community level change making. I'm going to go to the municipal council and ask them to create a new bike lane. Macro level is something like coal phase out, or our national mitigation commitment. And I advise people to choose the evidence-based target that is the most ambitious, that they feel that they can achieve with their given team and amount of resources, and then to be very, very attentive to the story or narrative that they are adding to the evidence in order to move people's hearts to accomplish the goal. So when we talked about coal phase out, we knew that it would, reduce, the evidence showed that it would reduce greenhouse gas emissions, but it also showed that it would reduce asthma exacerbations from air pollution. And that formed the basis of the story. So the story was about reducing emerge visits for kids. And the messengers of that story were health practitioners because, A, of their trusted status, which shows up in communications research, and also because there's evidence that speaking about climate change and other health things as a way to protect the health of children is the best way to motivate populations to take action across the political spectrum. So choose a story to help you accomplish your change-making goal that is in itself evidence-based. This is hard. It's hard to realize that sometimes the story that you tell is more important than the hard evidence that you were using to pick your target. But you can think about it this way, that stories are also evidence-based. And I find, and this is not something that's easy for me to do under current circumstances, but I'm basically doing a constant mental health check on my audience in general when I'm speaking. And so that lets me know if I need to go too slow, if I need to go faster, if I need to tell a joke. Because if people look like that guy in the middle, you need to switch it up. And so when in Zoom land, I actually tend to ask people to turn their videos on. I think it's better to start with as many videos on as you can. And then, you know, if you start to crash the system, you can always, Emma says nobody looks like that. Oh, you're sweet. They used to. So when I first started doing this, I was so anxious myself about it that I would just throw facts at people. And I do you know, psychiatric evaluation, so I have the ability to monitor affect, and I could tell it wasn't going well, so I actually baked cookies and brought them to every presentation I gave for about the first year I did this. So I'd wait until people looked like that, and I'd be like, oh my God, it's time to get out the cookies. And then I'd pass the cookies out, and then they'd look okay, and then we keep going. And then I eventually realized that I needed to change my actual presentation. And so I ratcheted back the level of problem. So now I'm usually at a 30% problem, 70% solution ratio. And it turns out actually that Nick Watts has ended up with that exact same ratio through similar trial and error. So I think that's not a bad ratio to sort of work with. There's different ways that you can alter it, but just that as a rule of thumb is probably not a bad one. And I really would encourage you to turn on your, get people to turn on their cameras if you can. And just really paying attention to the emotions. So this is a schema of Marshall Gans talking about action inhibitors and action motivators. So when you think about the narratives that we've been listening to politicians use lately in order to motivate people, you know, there's a lot of urgency, there's a lot of anger. You do sometimes see hope. What I really like to focus on is, at this moment particularly, because I know people's buckets are pretty empty, I'm really focusing on the bottom three here. Hope, solidarity. I really find change-making requires courage, and we don't talk about that very often. But really, when you think about what keeps somebody quiet in a room where they know that the conversation isn't evidence-based or ambitious enough, really, it's because they're scared to speak up. And so I'm doing my best to create a sense of solidarity amongst people, because that, I think, is the best way for us to support one another in ambitious work. And this feeling of you can make a difference, which is the examples of positive change making, which if you think about it, we haven't done a lot of that. We've probably published several thousand commentaries saying climate change is super bad and we need to do something or badness is going to occur. That's not helpful. Like, think about that in terms of this schema. Okay, so maybe you've got some urgency there and that's it. So, you know, that's sort of an example of how our communication strategy hasn't in fact been evidence-based in our overall sectoral approach to this topic. So lots of talk about, I often present Matthias. He's a little guy who was evacuated emergently from Fort McMurray with his parents during the wildfire there. And so it's no accident I talk about him and he has a name, because there's evidence that that will help. Human empathy is a spotlight, not a broad overhead light, and we are just wired to be more motivated to help a single person than, you know, 100 people with a similar problem. And that just has to do with how we were, you know, how we've evolved. But it's important you know that. And that's why the Lancet Countdown in 2019 used that as the narrative for the entire project. So this is completely evidence-based. The life of every child born today will be profoundly affected by climate change. And when you look at the number of media impressions they got worldwide, the year before, I think it was around 1.2 billion. That was the year I was their international policy coordinator. This year it was closer to 5. And the narrative, so the previous narrative had been about heat. This narrative was about protecting the health of a child born today. And so basically the exact same basically process with the same players involved, the same distribution network, got 5 times as much coverage, or 4 times, with a different narrative. So be really, really attentive to that. I can't really emphasize it enough. So a tale of 2 potential worlds, just in terms of a bit of a topic here, and that's, my slide is sort of funny. I'm finding that people are not realizing that we're going to get warmer no matter what. We've done a good job of emphasizing the need to mitigate, but we've somehow lost the need to adapt in the midst of this. So we are already committed to about 2 degrees Celsius further warming in Canada from a 1986 to 2005 baseline. And I find it really important to put a name to this. So I will, maybe the next slide has this. Yeah, so we'll put Matthias there and be like, look, in 2040, Matthias is only going to be 22. And we're going to be 2 degrees Celsius warmer than when I, for instance, graduated from high school. So that's hospitals we're building now need to be adapted to that. And I'm putting that up front these days because I don't think we're taking this into account. So this is the adaptation sprint that I often talk about. And then, of course, we have the mitigation sprint because right now we're tracking along the upper red line. So by 2080, Matthias will only be 63, and we're going to be 6.3 degrees warmer if we continue on that line. And we don't think we can adapt in a healthy way to that. So there are limits. There are maximal limits to adaptation, and we need to be humble and just try to prevent the problem. So that's our mitigation sprint. Important to know that there are solutions. So achieving a decarbonized global economy and securing the public health benefits it offers is no longer primarily a technical or an economic question. It's just a matter of getting it done. So it's a policy and political question. I did, because this is focused on equity, want to mention that there's an additional research sprint that we need to do. So this is Willow. Willow Thixon, she's just matching into residency. She's a UBC med student, and she is Indigenous and grew up on either side of the northern BC, northern Alberta border, and that is fracking country. And this is how she felt about the attention the communities she was born into are receiving from the public health community. Out of sight, out of mind. I can't get this slide out of my mind. And it's absolutely backed up if you go try to do a lit review. So essentially, it's important to know that LNG that we always hear talked about, that's pretty much fracked gas in Canada. And we have done not even close to enough research. There's 1 published study, and only a couple fracking-related projects have even been funded. Similarly, the very first motion I ever brought to the Canadian Medical Association General Council was asking that the CMA support increased peer-reviewed studies into the local toxic health impacts of the oil sands. That study has not been done. Pre-pandemic, Chief Alan Adams of the Athabasca Chippewan First Nation was in Ottawa asking for funding for that study. He didn't get it, went home, pandemic started, and he's in fact the chief who was in the news for having been beat up by the RCMP in a absolutely unacceptable way. So this is Elder Francois Paulette, who's an elder I've worked with a lot, basically presenting at the biggest climate change and health conference in the world. So this was at the last COP, the WHO conference, asking people to come to Canada to do research into the local health impacts of the oil sands and resource extraction. Now, I have to tell you that as a member of the Canadian medical and research community, this issue brings me more shame than anything else. There is no excuse for us in a high-income country with great research capacity that this is the case, and we need to look at ourselves very carefully and be brave and make sure that we speak truth to power and we get this done. You can tell this makes me mad. I wrote a letter emphasizing this around the Tech Mine decision, and it was signed by, I think we had 150 docs, and there were several similar letters by experts saying, look, like we can't have another mine when we don't even know what the health impacts are of the ones that we've had. And over the course of a couple of days, Jason Kenney had a press conference. He was really mad. We did some more media interviews, and a little while later, the last trip I actually ever had out of the NWT before the pandemic, we heard that Tech pulled its application. So I think that our voice was one of many voices raised to protest this, but it is important that we raise that voice. And I have to tell you that when I interact with this topic, I get scared. I don't sleep very well. I'm worried that I'm going to be targeted by all of these, different groups, but I do it anyway because that is what is right. And so I want to emphasize that, we all have privilege to be in the positions we're in, and exercising that privilege to stand beside disadvantaged populations sometimes is scary, but it's our job. All right, evidence-based images, climate visuals. This is the world's only evidence-based climate change photography resource, and if you're ever putting a report together, I would encourage you to go use these images because you can see they usually have people in them. There's usually a solution in there, so they've done a bunch of research, and I would go use those. Message testing is key. There's been a couple of really, really good sort of community-specific projects that have tested which narratives work best. Those are super important. We should be doing that with every single big initiative. So we'll tell you things like, in Alberta, they prefer language that building a transition towards something new is good. Don't talk about transitioning away from something old. There's an entire report about this. It's quite cool. There's another one on the future of coal in Saskatchewan. And what I'm really encouraging people to do is to take this moment in time as a moment to reset and reframe. And one of the initiatives I've been part of to help people do that is we came up with this Planetary Health Pledge for health professionals. It's essentially a Hippocratic oath for the Anthropocene that's meant to go beyond doctors to all health professionals. And you can see the very first line there is, I solemnly pledge to dedicate my life to the service of humanity and to the protection of natural systems on which human health depends. So something I've learned from the Indigenous community in which I live is that ceremony is important. And it's something that has kind of absented itself to a large degree from modern life. And I suspect, like so many things that have been part of human civilization forever, there's real value to ceremony, and François Paulette talks about this a lot. So we're organizing virtual and in some cases in person when it's possible, outdoor swearing ceremonies, oath-taking ceremonies for health professionals around the world this year so that we can use this moment as a moment to reset, to reframe, and to reorient our vision of what we need to do as we create a healthy future for all these lovely kids and people and family members and communities that we serve. So there you go.
Thank you so much, Courtney. That was an incredible presentation. I promise you I did not look like that person in the middle of that screen. I was alert. I was eating a muffin and not a cookie,
awesome.
But I just pretend that you brought it to me in an in-person environment. And what really resonated for me was, like, there's a lot, but highlights were your reflections that one of the primary ways that you can support global health is to actually advocate for action, global and local health, I should say, but you were speaking in the context of global health in your work with Doctors Without Borders, is to actually advocate for action on planetary health and addressing the climate emergency, and how you can have so much evidence and so much knowledge about why it's important to do this and be met with, and you can do a great job of referencing it and still be met with so little action. And so the other piece that really resonated for me was that need to use multiple strategies and tactics to make change happen, and to actually integrate in that, like, multiple strategies and tactics, is to actually look at that role for public health to contribute to the knowledge base, to publish and to look at what is working, what are problems, what are the health equity impacts of climate change in all of the different ways that happens, and contribute to that research base. So I think that's something that we don't necessarily hear about quite as much when it comes to climate change. We hear that there's so much evidence and so little action, which there is, but that piece about the role for public health and related researchers to actually contribute to the evidence base in new and different ways, I think, was particularly interesting for me. But Courtney, we did have a few questions for you, and so maybe we can go to those while we're sort of trying to figure out how to get Helen back set up again here. The first, they're actually both from Emma Fersen-Kaufman. And Emma, I'm not sure where you're speaking from. If you want to let us know in the chat box, that would be great. Emma's first question has to do with, how do we address the common sentiment that there's no point in making individual changes that address climate change when corporations and governments aren't doing enough? And I think probably Courtney might have something to say about that. The second question is a question about the Canadian public health community and wanting to know if they are actually involved in combating the climate impacts of Canadian resource extraction companies overseas. So the first question has to do with how do we get corporations and governments to do more? And the second question is about what is public health in Canada doing to combat resource extraction?
Sure. So in terms of change making, and this comes up a lot, I'm actually working on a document that came out of a consultation process that we did with sort of an international expert group around change making, because essentially it's been really convenient for powerful interests to tell us for decades that the reason why we haven't yet achieved a healthy response to climate change is because we're not good enough, because me, Courtney, haven't managed to completely decarbonize my life in the subarctic. And so because you are not perfect, you basically can't speak, and we are going to silence you and guilt trip you. And what's super convenient about that for corporations and anybody who benefits from sort of status quo is that then they get to just sort of hang out and keep doing what they're doing. And so what I like about being really clear about the micro, meso, and macro level of targets is that we're saying, look, doing something, what you can do within your own life is really important. However, it's only part of the solution because, for instance, my husband and I just bought a new car, but we had to buy a plug-in hybrid instead of just a plug-in because when we went and looked at the map of the charging stations, we really weren't convinced that we could reliably get from Yellowknife down to Alberta without running out of charge. And so that makes it really clear that at that point, in order to facilitate an individual level change, we need meso and macro level change. And so the way I invite people to think about this is to, there's going to be different seasons in life for different types of work. There's different skill levels. So a lot of the time people will learn the material making individual level change, and that's going to help them be effective when they make meso or macro level change. You find your people, you can take on a bigger target. And so we like to talk about a laddering engagement with levels of intervention at different levels. But I think it's pretty useful to be realizing how super convenient it's been for people to play gotcha. So if anybody ever tries to play gotcha and is like, you can't talk about this, you can't advocate for better policy because I saw you got here in a car and it was gas powered, so how dare you even speak, right? They're trying to silence you. It's a deliberate tactic, and that's when you say, hey, we need to make change at all levels in order to achieve the scale of change that we need to make. In terms of resource extraction, so because basically think about resource extraction with the same lens that you think about tobacco companies. So when we look at how basically public health has interacted with tobacco, and we look at the game plan that tobacco companies have used in order to try to stymie public health work. Basically, the fossil fuel companies in some cases use the exact same communications consultants and the exact same playbook. So there's a really interesting book called Merchants of Doubt, which really lays it out. And so basically, there's been a deliberate attempt to A, silence critics, and B, disseminate misinformation. And all of those things make it scary to interact with this issue. So when we look at what's happened across Canada to health practitioners and public health docs who worked with this, so David Swan back in the day got fired for talking about climate change as a public health officer in Alberta. Then we saw Ailish Cleary, who put out the first good report on fracking in New Brunswick, and then went on to be working on glyphosate and mysteriously also lost her job. We see John O'Connor, who was working just downstream from the oil sands as a family doc, and he wasn't an activist at all. He was just a family doc. And he happened to very naively, because he never had any media training, basically a reporter, an international reporter, came to the oil sands, and he was in the nursing station, and he happened to make a comment to the reporter that, you know, he diagnosed quite a few rare cancers in this small community, and it made him wonder if maybe there was something with the water, and maybe it had something to do with the oil sands. And he made international, like 2 days later he woke up to find out that that quote was plastered all over international papers. And so he was completely flabbergasted by it all. And people got super mad. So Health Canada accused him of inciting undue alarm. His license was put in jeopardy. He ended up having to move. And so there has been violence perpetrated against quote-unquote whistleblowers, and that has really helped to silence people. And so that is one of the reasons why solidarity is so important. It's one of the reasons why having your science really straight is super important, so people can't get you there. It's one of the reasons why relationships are so important. So when I'm working on that, I know behind the scenes, I know people all across the spectrum. So I'm in contact with the actual public health doctors often. I'm also in contact with the environmental activists on the ground, and everybody can take action at a different level of risk. And I think the best and safest maneuvers are when we're each being as brave as we possibly can be at our spot on the spectrum, and have that entire team ready to provide defense if industry or other powerful interests decide to try to target us. So basically the answer to your question is we haven't done it at anywhere near the scale required. It's because everybody's been scared, and I think solidarity is the answer to that. And yes, it is going to require us being uncomfortable, but that is still the ethical course for us to take.
Thanks so much, Courtney. That was a great answer to that question, a tough one, and I completely agree about the level of scale needed